Welcome to Dr. Ravichandra Official. Please like, share, and subscribe Dr. Ravichandra Official for more interesting videos on pathology. Today, in this video, we will discuss the multiple choice questions that were being given in the KNRUHS General Pathology and Haematology exam for MBBS students in January 2025. Let's start the video. First question: all of the following are examples of apoptosis except option A, hormone-dependent involution of endometrial cells. Option B, councilman bodies in viral hepatitis. Option C, programmed cell death. Option D, T cell depletion in AIDS. Answer is T cell depletion in AIDS. T cell depletion in AIDS is an example of necrosis or pyroptosis or but not apoptosis. Apoptosis is a form of programmed cell death that is regulated by a specific cellular pathways, whereas necrosis is a form of cell death that results from cellular injury or infections. Coming to the other options, hormone-dependent involution of endometrial cells. Apoptosis play a role in the menstrual cycle, where hormonal changes induces apoptosis in endometrial cells. Option B, councilman bodies in viral hepatitis. Councilman bodies are apoptotic hepatocytes that are characteristic of viral hepatitis. Programmed cell death is a general term that refers to apoptosis, which is a regulated form of cell death that is essential for normal development and tissue homeostasis. So, the answer for this question is T cell depletion in AIDS. Next question, syphilitic involvement of aorta is observed in option A, descending aorta, option B, arch of the aorta, option C, abdominal aorta, option D, bifurcation of aorta. The correct answer is descending aorta according to the options given. But actually, it is the ascending aorta where the syphilitic involvement is observed. Syphilitic aortitis typically affects the ascending aorta, which is the portion of the aorta that arises from the left ventricle and extends into the aortic arch. The inflammation caused by the syphilis can lead to damage to the aortic wall, resulting in aneurysmal formation or aortic regurgitation. While the descending aorta can also be involved, the ascending aorta will be the most commonly affected region. The other options are less commonly involved in syphilitic aortitis. Lysosomal storage disease with histiocytes in marrow and spleen demonstrating option A, Gaucher's disease, option B, Niemann-Pick disease, option C, hemophagocytic syndrome, option D, Hunter syndrome. The correct answer, according to my opinion, is it is both Gaucher's disease and Niemann-Pick disease. Both these diseases are lysosomal storage diseases characterized by the accumulation of lipids in the histiocytes, leading to their infiltration in the bone marrow and spleen. Coming to the hemophagocytic syndrome, this is a rare disorder of the immune system, but it's not a lysosomal storage disease. And Hunter syndrome is a lysosomal storage disease, but it primarily affects the brain and skeletal system rather than the bone marrow and spleen. Vitamin D deficiency causes all except craniotabes, pigeon chest deformity, Harrison's groove, Bitot spot. The correct answer is Bitot spots. Bitot spots are a characteristic of vitamin A deficiency, not the vitamin D deficiency. Bitot spots are triangular, foamy, or cheesy patches on the conjunctiva of the eye. Craniotabes is softening of the skull bones in infants due to vitamin D deficiency. Pigeon chest deformity, also called as pectus carinatum, can be caused by vitamin D deficiency. Harrison's groove is a horizontal groove on the chest wall, typically seen in children with rickets due to vitamin D deficiency. All of the following is associated with iron deficiency anemia except option A microcytic RBC, option B hypochromic RBC, option C Plummer-Vinson triad or Plummer-Vinson syndrome, option D pancytopenia. The correct answer is pancytopenia. Pancytopenia refers to a reduction in all three blood cell lines: red blood cells, white blood cells, and platelets. While the iron deficiency anemia can cause a decrease in red blood cells, it does not typically cause pancytopenia. Microcytic RBCs are characteristically seen in iron deficiency anemia, and the iron deficiency anemia will also cause the red blood cells to be pale due to lack of the hemoglobin. And Plummer-Vinson triad or syndrome is a rare condition characterized by dysphagia, esophageal webs or post-cricoid web, and iron deficiency anemia. Beta thalassemia is characterized by all except option A deficient synthesis of beta globulin, extramedullary hematopoiesis seen in Mediterranean countries, the macrocytic RBCs. The correct answer is macrocytic RBCs. Beta thalassemia is characterized by microcytic red blood cells but not macrocytic red blood cells. Deficient synthesis of beta globulin is caused by mutations in the hemoglobin gene beta that leads to reduced or absent production of the beta globin subunit of the hemoglobin. And extramedullary hematopoiesis occurs when the marrow is unable to produce enough red blood cells, leading to the production of blood cells in other organs such as liver and spleen. And beta thalassemia is common in Mediterranean countries such as Greek, Italy, Turkey, and in other parts of the world with high frequencies of thalassemias. Massive splenomegaly is characteristic clinical feature of all except chronic myeloid leukemia, Gaucher's disease, Kala-Azar, and typhoid fever. The correct answer is typhoid fever. Splenomegaly is enlargement of the spleen. It can occur in the typhoid fever, but massive splenomegaly is not a characteristic feature. The remaining other options, chronic myeloid leukemia, Gaucher's disease, and Kala-Azar, in all these, massive splenomegaly is seen. And massive splenomegaly is a common finding in chronic myeloid leukemia. And massive splenomegaly is a characteristic feature of Kala-Azar fever. Massive splenomegaly can occur in Gaucher's disease due to accumulation of the glucocerebroside in the spleen. Anticoagulant suitable for storing blood for transfusion is heparin dextrose citrate, EDTA dextrose and saline, phosphate dextrose and citrate, oxalate phosphate and glucose. The correct answer is citrate phosphate dextrose, CPD, or you can call it as citrate phosphate dextrose adenine, CPDA1. Citrate is the anticoagulant of choice for storing the blood for transfusion because it will chelate the calcium ions, preventing the clotting, and it also preserves the viability and function of the blood cells, and it has a relatively long shelf life. Heparin is not typically used for blood storage due to its short shelf life. EDTA is commonly used for laboratory tests, but it's not suitable for blood storage. Oxalates is not typically used for blood storage. Stem cells are present in option A bulge area of the hair follicle, canals of hair rings in liver, base of the crypt in small intestine, all the above. The answer is all the above. Stem cells are present in all these areas. The bulge area of the hair follicle contains stem cells that are responsible for the regeneration of hair follicles. The canals of the hair rings in the liver contain stem cells that can differentiate into hepatocytes and bile duct cells. The base of the crypt in the small intestine contains stem cells that are responsible for the regeneration of the intestinal epithelial cells. These stem cells will play an important role in maintaining the tissue homeostasis and regeneration. Mast cell is a source of inflammatory mediator for option A complement, option B chemokines, option C kinins, option D histamine. The correct answer is histamine. Mast cells are a type of immune cells that will play a key role in the inflammatory reactions. They are a rich source of histamine, which is a potent inflammatory mediator, and it will cause vasodilatation, increased vascular permeability, smooth muscle contraction. Mast cells can also produce other inflammatory mediators such as chemokines, cytokines, but histamine is their most characteristic and abundant product. Thank you for patient listening. Please like, share, and subscribe Dr. Ravichandra Official for more interesting topics and videos in pathology.